Welcome to UVA Health's point-of-care instructional video on the Nova StatStrip Glucometer. In this video, you will be learning what it takes to perform basic operation, including reporting results, maintenance, and troubleshooting of your Nova StatStrip Glucometer. Completion of this module does not automatically grant the user access to the Nova StatStrip Glucometer. Users must also complete a hands-on assessment during which the user will be observed running at least one level of quality control. To maintain access to the Nova StatStrip Glucometer, users must also complete an annual competency assessment with either a super user or a member of the point-of-care team. Once granted access, employees are responsible for all testing under their badge ID. Never share your badge ID with another operator. Not only is it against hospital policy, but you may also face disciplinary action. Supplies. The supplies needed to perform testing with the Nova StatStrip Glucometer include the Nova StatStrip Glucometer itself, a docking station, StatStrip glucose testing strips, StatStrip controls level 1 and 3, and any additional supplies needed for the phlebotomy of the patient. The Nova StatStrip Glucometer is a touchscreen point-of-care device that analyzes whole blood glucose. This glucometer comes equipped with scanner located at the top of the device. At the bottom of the device, you will find the test strip port and the docking station connector. Glucometer bases may come in double or single base units as seen here. Always ensure your glucometer is docked when not in use. This will facilitate the transmission of patient results and keep the device charged. When charging, the indicator light will appear amber and will turn green once fully charged. Nova StatStrip glucometers are compatible with the StatStrip Express glucose testing strips. When stored at room temperature unopened, glucometer strips are good until the manufacturer's expiration date. Once opened, the testing strips are valid for 6 months or until the manufacturer's expiration date, whichever comes first. Always be sure to write the open and expiration dates on the outside of the container in the month, day, and year format. Green stickers are available for this purpose. However, if green stickers are unavailable, it is acceptable to write the open and expiry dates with a black permanent marker. The Nova StatStrip Glucometer uses StatStrip Express control levels 1 and 3. Glucometer controls should be stored at room temperature. When unopened, they are good until the expiration printed on the bottle. Once opened, glucometer controls are good for 3 months or the manufacturer's expiration date, whichever comes first. Always place the open and expiry dates on the outside of the container. In this example, the manufacturer's expiration date is being used because it comes before the 90-day expiration date. And remember, always write open and expiry dates in the month, day, and year format. Quality controls. Quality controls, or QC for short, are performed every 24 hours on the Nova StatStrip Glucometer to verify analyzer performance and accuracy of patient results. The quality controls consist of 2 levels of QC, level 1, the low level, and level 3, the high level. Both levels of QC must pass in order to unlock the glucometer for patient testing. To run quality control, press Login on the main menu. Scan your badge ID. QC lockout engages after 24 hours has passed from the previous QC. You can tell a glucometer is locked out because of the padlock present in the black box. The statement in red saying level 1 and 3 glucose QC required, and the absence of the accept button at the bottom of the screen. To begin the QC test, press QC. Next, we will scan the strip lot barcode. The steps can also be found in the blue information bar at the top of the screen. Once the strip lot is scanned, the glucometer will ask for QC lot number. You may run the QC in any order you like, as the barcode will also indicate what level you are running. After scanning the QC barcode, the screen will change, indicating to the user to place the glucose test strip into the glucometer. With gold end facing closest to the glucometer, gently but firmly push the test strip into the port until the picture on the screen changes. Never force a test strip into the port by pushing the tip of the strip, as this could cause the strip to break off inside the strip port. We will now place a drop of QC into the strip by holding the bottle parallel with the strip and gently expressing a drop at the edge of the strip. Be sure to observe the QC ascend the strip. If the liquid does not fully ascend, remove the strip and begin again. Once enough QC has been absorbed into the strip, the meter will beep and a countdown will begin. After 6 seconds, your QC result will appear. When QC passes, you will see the word pass against a blue background. On occasion, QC may fail. A QC failure appears as the word fail against a red background. When a QC failure occurs, a comment must be entered. Press the comment button on the lower right hand of the screen. You will be provided with a list of comments. Pick the comment that is most appropriate. When finished, hit the green Accept button at the bottom of the screen. As stated previously, QC is performed every 24 hours. However, there may be other times to perform QC as well. These include when opening a new container of strips, if patient results are inconsistent or unexpected, or if the meter has been dropped. Additionally, one level of QC is required as part of your initial training and annual competency assessment. Patient testing. To run a patient test, log into the glucometer by scanning your badge ID. To determine if the glucometer is ready for patient testing, look for the following. The padlock is absent from the black box. The green Accept button is present, and the blue information bar states Patient Test. Once you have confirmed the glucometer is ready for patient testing, you can begin a patient test by verifying the patient with at least 2 patient identifiers. Hit the Accept button at the bottom of the screen. Touch Scan and scan the test strip barcode. Next, scan the patient's ID. Always use the patient armband when available. In outpatient areas, a patient barcode label is acceptable. In point of care, we use the CSN or contact serial number to ID our samples. The CSN is a 12-digit unique identifier assigned to each patient visit or encounter. The CSN is present on both the patient armband and labels. Always verify you have the correct CSN for the appropriate patient encounter to prevent results from being held and not transferring into the patient's medical record. Once the patient ID has been scanned, you can insert the test strip. Now you are ready to add your sample. When performing capillary puncture for glucose testing, be sure to complete the following. After prepping either the middle or ring finger with an alcohol prep pad, allow the puncture site to completely dry prior to puncturing the patient's skin. Once punctured, wipe away the first drop of blood and only use the second drop for testing. This helps prevent sample contamination. And never hold the glucometer at an upward angle, as this could cause blood to run into the strip port, damaging the interior components. Once the sample is applied, the glucometer will provide a countdown prior to displaying the patient results. Press the green Accept button. Once testing is complete, be sure to dock your glucometer after cleaning and disinfecting to ensure patient results transfer into the patient's chart. Resulting. The normal range for a patient glucose is 70 to 99 milligrams per deciliter. However, critical levels may occur. Here at UVA, critical glucose results are less than 54 or greater than 600 milligrams per deciliter. If your patient has a critical result, be sure to retest your patient. This is especially important if the patient results do not fit the clinical picture, or if it is the first time you are seeing a critical result on a patient. To ensure timely transfer of patient results, always be sure to provide a comment on any critical result. To add a comment to a critical result, press the comment button in the lower right-hand corner of the screen. There will be several comments to choose from. When retesting your patient, use will repeat. Once the critical result is verified, report the critical result to the RN or provider and choose the appropriate comment. Please follow all hospital policies for charting and reporting of critical levels. Cleaning and disinfecting. Nova StatStrip glucometers should be cleaned and disinfected after every use. Approved cleaning materials include Super Sanicloth germicidal wipes, seen in purple, and Sanicloth bleach wipes in orange. For most patients, Super Sanicloth germicidal wipes may be used. However, Sanicloth bleach wipes must be used on any patients infected with C. diff. No matter the type of germicidal wipe, glucometer cleaning and disinfection will take 2 wipes. To begin, remove 1 germicidal wipe from the container. Wring out the wipe to remove any excess liquid. Vigorously wipe each side of the glucometer, removing blood or any other material that may be on the glucometer's surfaces. While cleaning, be sure to handle the following areas with extra care: the scanner, the strip port, and the docking connector, as excessive moisture can damage these areas. Next, we will remove a second wipe. Repeat the same steps as previously stated. However, you must leave the surfaces of the glucometer wet for the appropriate amount of time, depending on the type of wipe you're using. For Super Sanicloth germicidal wipes in the purple container, surfaces must remain wet for 2 minutes. For bleach wipes, surfaces will need to remain wet for 4 minutes. If surfaces begin to dry, use another wipe to re-wet the surfaces until the time is complete. Never wrap your glucometer in Sani wipes, as this can damage your analyzer and cause a delay in patient care. Once you have allowed all surfaces to completely dry, you can remove any remaining residue with a piece of water-moistened gauze or an alcohol pad. Once completely dried, return the glucometer to the docking station. Troubleshooting. In this final section, we will be reviewing some basic troubleshooting steps. Low battery. Nova StatStrip glucometers come with a rechargeable battery. To keep your battery charged, be sure to dock the meter after every patient. Docking also ensures that patient results transfer into the EMR. Hard reset. For software-related malfunctions, including frozen screens and scanners failing, users can perform a hard reset. Complete a hard reset by opening the back panel and removing the battery. Leave the battery out for 1 to 2 minutes, then replace the battery in the correct orientation with the gold plates of the battery contacting the gold pins of the glucometer. Push the battery firmly into the glucometer and replace the back panel. Additional errors. You may experience some additional errors. One such error is a flow error. Flow errors may occur when too little sample is placed on the strip. If this occurs, remove the strip and start again with a new strip. Another error that may be encountered is a replace strip error. These errors generally occur sometime during analysis or immediately after strip insertion. Simply remove the strip that prompted the error and replace with a new test strip. If your attempts at troubleshooting have failed and you are located at the main hospital or work with inpatients, take a glucometer to the blood bank on the 2nd floor of the hospital near the OR to exchange for a loaner. Always be sure to leave an adequate description of what is wrong with your glucometer, such as not downloading patient results, scanner not working, or multiple test errors encountered. When taking out a loaner, especially on floors where glucometers are located in each patient's room, note where the glucometer is located by writing the room number on the board. Or keep the loaner in one of the first 1 to 2 rooms in your area. This will help glucometer returns go quickly and smoothly. Corrections. Point of care may reach out to you in the event patient results do not cross into patient's chart. We will ask you to fill out a correction form in order to correct the sample ID or any additional errors that may have occurred preventing the release of results into the patient's chart. Please fill out the form to the best of your ability. All point-of-care lab tests performed on a patient need to be resulted into a patient's chart under the lab section. Charting of a glucose result is not a substitute for a properly resulted glucose test. This concludes the Nova StatStrip Glucometer module. To complete your initial training, you still must complete the hands-on portion. For any additional questions or help troubleshooting, please reach out to the UVA Health Point of Care Department at askpointofcare@uvahealth.org.